I want to take a moment to talk about neonatal resuscitation. Primarily, the objectives to doing the actual basic life support is very, very similar in technique to the infant CPR that you've already seen. However, in the neonatal, there are some points that we need to differentiate the two. First of all, I think it's important that we talk about what are our age differences. Keep in mind that a neonate is normally 1 month or younger and normally looked at as a newborn. So whenever we talk about neonatal resuscitation, they don't have to have size difference. And I kind of put two baby mannequins here to show you a neonate may be smaller than an infant. Infants are 1 year or less. The neonate is 1 month or less, because you can have a 12-pound baby. So it could be a very large newborn. Neonate has more to do with how recently were they born. The neonatal resuscitation differentiates a bit from the CPR of an infant in that it is still airway breathing primarily focused. Airway breathing and circulation. Whereas the infant, children, and adults, the new guidelines are now really promoting that we are following the compressions first, then airway breathing. Neonates are so driven primarily from a lack of oxygen that it is of utmost concern for us to make sure that they have a patent airway and that we're getting them the oxygenation that they need. Now, there's a lot of debate going back and forth about do they need to have hyperoxygenation or high concentration oxygen, and that is still out and enters into the advanced life support realm more than the basic life support. But one of the biggest differences is that we're going to be doing a 3 compression to 1 respiration model for CPR. Remember, in the infant, we were doing 15 compressions to 2 with 2 rescuer CPR and 30 compressions to 2 breaths with 1 rescuer CPR on the infant, child, and adult, 1 rescuer. Neonatal is 3 compressions to 1. That's fast. That's a lot of compressions and a lot of respirations. The respirations for a neonate that has a pulse, and keep in mind, in a neonate, unless they've already been released from the hospital, they're going to have pulse oximetry. They're going to have probably a heart rate monitor. We're going to have other devices available to help us to monitor the blood pressure of the neonate, the pulse rate of the neonate, the pulse oximetry of the neonate. The skin color obviously is very important. So the respirations or rescue breathing for a neonate is really going to be emphasized on heart rate, the blood pressure, and the pulse oximetry and color of the baby. Are they moving around? Are they alert? Are they pinking up? So those are some of the differentiating aspects that we need to keep in mind when we're talking about neonatal basic life support. 3 to 1, checking for color, movement, blood pressure, pulse oximetry in resuscitating the baby. Those are the things we're going to be watching for in the neonatal, something to keep in mind as we differentiate.